This morning we're here with Dr. Kenneth Iserson, author of the new 8th edition of Getting into a Residency, a guide for medical students, to discuss specialty training for DO students and graduates. Dr. Iserson, as a DO student, what options are there for specialty training?
Jen, the rules are going to change over the next few years, but for now, there is the AOA-approved internship. There's the AOA-approved internship combined with a residency, or the MD, which are known as ACGME-approved internships and or residency programs.
What are the options for an AOA-approved internship?
Jen, the options are very similar to those available to MD students. The first is that the internship is considered the first year of residency training. The second is that students match with a residency program, and those programs generally arrange for an internship. And the specialties that do this are diagnostic radiology, neuromusculoskeletal medicine, OMT, ophthalmology, pathology, physical medicine, rehabilitation, and radiation oncology. The third option is the traditional rotating internship. And there's three reasons to take that. The first is for those students who have not yet decided on a specialty. The second is for those who don't plan on going into a residency, a bad idea. And third is for those who wish to enter one of the specialties that don't go through a match, dermatology and public health preventive medicine in osteopathic medicine.
Do you have to take an AOA-approved internship?
No, you don't have to take an AOA-approved internship, but in 4 states, you may not be able to get a medical license without having an AOA internship, although they make exceptions on occasion. Those are Florida, Michigan, Oklahoma, and Pennsylvania.
What are specialty emphasis and specialty track internships?
While there are slight differences between the two that I describe in the book, in reality, the specialty emphasis and specialty track internships allow DOs to begin their training during internship. Specialty emphasis are in anesthesia, emergency medicine, family practice, general surgery, psychiatry, and diagnostic radiology. Specialty track are internal medicine, pediatric combination, OBGYN, otolaryngology, facial plastic surgery, pediatrics, and urology.
What training options do DOs have after taking an AOA-approved internship?
There are 3 basic options for obtaining a residency. The first is to directly contact MD or AOA-approved residency specialty programs to see if they'll let you in. The second is to apply for an MD residency through the NRMP or one of the other matching programs as an independent candidate. You can do this in your senior year or during your intern year. The third option is to apply for a residency position while you're in an AOA-approved internship, but starting at the PGY1 level. The option you choose depends on your personal situation and your competitiveness in the specialty of your choice. However, you've got to remember that the AOA, ACOM, and the ACGME are currently discussing unifying the training programs and presumably the NRMP match, and that will be discussed in the next video.
What are dual-approved programs?
The problem has been that there are too many DO graduates each year to be accommodated by the available spots in AOA-approved programs. Therefore, the AOA and ACGME have agreed to dually approve certain programs, called dual-approved programs. People in those programs are clinically integrated, they're in the same training situation, and when they finish, they're eligible to take both the MD and the AOA's specialty board exam.
Dr. Iserson, is there more DOs should know about programs and the match?
Yes, there are. And we'll discuss those in the next video.